In a typical 12-year-old child, the wisdom tooth develops in a sac. Through the next few years, eruption takes place, the root begins to develop, and the crown moves closer to the surface of the jaw. By late adolescence or early adulthood, full eruption takes place. In some instances, the jaw may have enough room and the teeth can be completely serviceable. But frequently, these teeth have many problems and the jaw has not enough room for the teeth to erupt. This is referred to as an impaction. Impaction is a general term that is applied to any tooth that does not have room to come into normal position to provide a usable chewing surface. There are many kinds of impactions. A soft tissue impaction is where there isn't sufficient room for the tooth. The gum tissue over the tooth prevents the area from being properly cleansed by brushing. Bacteria beneath the gum flap may cause the gum to swell and infection begins. A partial bony impaction is where the bone partially covers the crown, which prevents you from maintaining good oral hygiene. A full bony impaction is where the crown of the tooth is completely covered with bone. Occasionally, bacteria may find their way into this area and infection develops. This may occur at an older age. Do you recall the sac which is present around the wisdom tooth? Well, in the eruption of the tooth, the sac disappears. When the tooth does not erupt, the sac shrinks to become a membrane. On rare occasions, this membrane begins to grow and then becomes a cyst filled with fluid. If this remains untreated, the cyst may become so large that bone is destroyed and the jaw is weakened. Often the person is unaware of this condition. When wisdom teeth partially erupt, decay may begin in the wisdom tooth or may even involve the molar tooth in front of the wisdom tooth. On rare occasions, the pressure from the wisdom tooth may damage the tooth next to it. As we get older, our jawbone becomes harder and denser, and impacted wisdom teeth become more difficult to remove. Removing it at an earlier age may be less traumatic. Following your examination, along with a review of your x-rays and determining your wishes, your doctor will provide you with information about the best means of treatment for your wisdom teeth. Your doctor may also advise you of any alternatives or choices you may have. Remember that any decision regarding the removal of a tooth is ultimately yours. Some wisdom teeth may be removed under local anesthesia. This is similar to when a dentist numbs you for a filling. Various forms of sedation are available which make you feel relaxed and somewhat sleepy. Your doctor will inform you of the choices of anesthesia offered. Various techniques are used to remove the impacted tooth. This depends primarily upon the position of the tooth itself. Occasionally, it is necessary to remove a small section of bone overlying the tooth. Once this is accomplished, the tooth may be removed. Frequently, the tooth is then brought through the bony opening for removal in sections. As with any surgical procedure, complications may occur following the procedure, even though the procedure itself was performed with reasonable care. Keep in mind that with any surgical procedure, recovery following surgery may vary widely according to the difficulty of the procedure itself. Discomfort, bleeding, bruising of the skin, and swelling are not uncommon after the removal of a tooth. Usually within a few days, these symptoms will subside. Your doctor will give you a prescription for any anticipated discomfort. Instructions will be given to you regarding other post-operative problems. Infection may occur as a result of an impacted tooth prior to its removal, and after its removal. Your doctor can prescribe the appropriate antibiotics. Should the blood clot be lost from the tooth socket, your doctor may place a sedative dressing in the extraction site. This helps relieve any discomfort you may have. This condition is referred to as a dry socket. A sensation of numbness in the lip may occur. This complication occurs when the nerve is affected during the removal of the tooth root. Nerve injury is a known but infrequent complication. If it occurs, the lip numbness is usually temporary, but in rare circumstances has been known to be permanent. Wisdom teeth and their roots are near nerves that provide taste and sensation in the tongue. Occasionally, during the extraction of the wisdom teeth, these nerves can be affected, which may cause numbness and a loss of taste to half the tongue. This effect is usually temporary, but on rare occasions has been permanent. Occasionally, a root of a wisdom tooth extends into the sinus. When the tooth is removed, an opening may be present through the tooth socket into the sinus. Most openings close on their own. However, in rare instances, it may have to be closed surgically. On rarer occasions, a root tip or tooth may be dislodged into the sinus area and may require more surgery. Discomfort, bruising, and swelling in the area of an injection of a vein used for medication may occur. This is rare and seldom serious, but should be reported to your doctor. Potential injury to a tooth located in the front of the wisdom tooth is always of concern, as these teeth may have large fillings or have extensive decay. This may require some additional dental work and the filling replaced. Another extremely rare complication is the fracture of the bone through the socket of the wisdom tooth area, which would also require further treatment. The removal of wisdom teeth necessitates that the jaw be opened fully for a period of time. The joint is protected during surgery by the use of a mouth prop. Patients with a prior history of joint disorders must be aware of possible reoccurrence. Patients should be aware that stiffness and the inability to open the jaw fully for a period of time following the surgery is not uncommon. Root tips may occasionally be left behind if your doctor feels the risk of complications from their removal outweighs the risk of leaving them behind. Normally, these complications do not occur, and your recovery is within a few days after surgery.